Massage Therapy Test Practice Exam and Study Guide, 25 Challenging Questions. Question 1. In muscle action, the muscle that performs the opposite movement of the agonist is called the synergist, fixator, antagonist, abductor. The antagonist is the muscle that opposes the prime mover, agonist, to control and balance movement. Question 2. The long, central shaft of a long bone is known as the epiphysis, periosteum, diaphysis, endosteum. The diaphysis is the main or midsection, shaft, of a long bone. Question 3. Which term describes the site where two bones meet to form a joint? Ligament, articulation, insertion, origin. An articulation, or joint, is the point of contact between bones. Question 4. A massage stroke that involves pressing and rolling the muscles is known as effleurage, pétrissage, tapotement, friction. Pétrissage consists of kneading, wringing, or rolling the muscle tissue. Question 5. In the SOAP note format, which section includes the therapist's observations of the client's posture and gait? Subjective, objective, assessment, plan. The objective section contains measurable and observable data collected by the therapist. Question 6. Which of the following is a contraindication for deep tissue massage? Chronic muscle tension, acute inflammation, reduced range of motion, healed scar tissue. Deep tissue massage should be avoided in areas of acute inflammation to prevent further tissue damage. Question 7. The anatomical plane that divides the body into front and back portions is the sagittal plane, transverse plane, frontal, coronal, plane, mid-sagittal plane. The frontal plane, coronal, divides the body into anterior, front, and posterior, back, sections. Question 8. Which system is primarily responsible for the fight or flight response? Parasympathetic nervous system, somatic nervous system, sympathetic nervous system, enteric nervous system. The sympathetic nervous system activates the body's response to stress or danger. Question 9. What is the primary effect of effleurage on the circulatory system? Decrease in blood pressure, increased venous return, reduced heart rate, increased blood viscosity. Long, gliding effleurage strokes toward the heart encourage the flow of blood and lymph. Question 10. A trigger point is best described as a site of bony overgrowth, a hyperirritable spot in a taut band of muscle, a type of ligament tear, a nerve root compression. Trigger points are localized areas of high irritability in muscles that can cause referred pain. Question 11. Which of the following is an example of an ellipsoidal, condyloid, joint? Hip joint, wrist joint, radiocarpal, elbow joint, saddle joint of the thumb. The radiocarpal joint is a condyloid joint, allowing movement in two planes. Question 12. The Greek root derm refers to which part of the body? Muscle, bone, skin, nerve. Derm or derma relates to the skin, example dermatology. Question 13. To help a client with a 3-day-old ankle sprain, the therapist should apply deep friction to the ligament, massage the whole limb gently but avoid the injury site, massage proximal to the injury to encourage drainage, use hot stones directly on the swelling. Massaging proximal to an injury helps reduce edema by clearing the pathway for lymphatic return. Question 14. Which muscle is the primary muscle of respiration? Internal intercostals, pectoralis minor, diaphragm, scalenes. The diaphragm is the main muscle responsible for breathing. Question 15. What does the term medial indicate in anatomical terms? Away from the midline, toward the midline, above another structure, below another structure. Medial means toward the center or midline of the body. Question 16. The process where a client displaces feelings for someone else onto the therapist is called countertransference, transference, dual relationship, boundary crossing. Transference occurs when the client projects emotions or expectations onto the practitioner. Question 17. Which type of connective tissue connects bone to bone? Tendon, ligament, fascia, cartilage. Ligaments are tough bands of fibrous tissue that connect bones to other bones. Question 18. What is the purpose of draping in a massage session? To keep the client warm only, to provide professional boundaries and client modesty, to save on laundry costs, to allow the therapist to work faster. Draping is essential for ethics, professionalism, and ensuring the client feels safe and respected. Question 19. The endomysium is a connective tissue layer that surrounds the entire muscle, a bundle of muscle fibers, fascicle, an individual muscle fiber, the tendon. The endomysium is the innermost layer of connective tissue surrounding each muscle cell, fiber. Question 20. Which massage technique is best suited for breaking up adhesions in chronic scar tissue? Light effleurage, deep cross-fiber friction, vibration, tapotement. Cross-fiber friction is specifically designed to realign fibers and break down adhesions.